I am not Deborah Meeker. I'm actually Elin Dowd. I'm up here twice on your screen, possibly. So welcome to our Benefit Clerk annual webinar. Last year we had our Benefit Clerk meeting and we called it training, and a lot of benefit clerks didn't show up because they already knew the ropes. But this year we advertised it a little bit differently because there are so many things that change each year regarding your benefits. This is an opportunity for us to all come together, hear the same thing, get on the same page, and talk about what those changes are right before we go into open enrollment, and talk a little bit with Excelis about open enrollment and how that is going to flow this year. So thank you for joining us and welcome. I know this year has been a most unusual year. And I found that the consortium was being used in many different ways than it has previously. We had a lot of phone calls, obviously, regarding COVID coverage, what the waiving aspects of coverage were, but also about testing, a ton of questions about testing and things like that. So an unusual year for us, learning as we went about this pandemic and what it meant to your healthcare plan. We also had a lot of questions regarding furloughs and layoffs and how municipalities could change plans, doing a lot of cost comparisons, providing a lot of data to help you communicate with your employees. Also, because of layoffs and furloughs and things like that, a lot of requests were made regarding COBRA. What do I do? Is this person eligible for COBRA? How do they pay for it? How do I pay Excelis? Whom do I notify? What kind of paperwork? And then also as the pandemic went on and time went on, also some of the mandates changed, including some mental health benefits for essential workers, but also just mental health in general, as people were becoming more depressed about the pandemic and staying home and how all our lives have changed. Kids not going to school, maybe going to school, being anxious about them being at school, college towns being populated, not populated, maybe populated. So some of the mental health questions about benefits have come up. And in addition to mental health, what kind of support are you giving us regarding wellness? I feel like the consortium has been well utilized this year. I'm not going to say that last year we weren't doing anything, but this year we have certainly been busy. So today we want to cover a lot of topics, and we're going to try to run through them quickly so we're not stuck on Zoom all day, but we also want to provide opportunities for you to ask questions to get the information you need. And I think the most important thing today for you to walk away with is who to contact. So both Excelis and ProAct will be walking through how do you get your answers, questions to your answers quickly and effectively, and what's the best route for you to take. And I know a lot of you in the past
I can't figure out what's wrong. It took a long time starting up.
You got the power? I think.
Thank you. I know a lot of you have been used to calling Beth and calling Corey directly, and they may be routing you in other directions. Also, if you call the consortium, we're giving you more resources on how you find information. And one of the reasons for that is because we have grown from an entity of 13 municipalities to now 15 municipalities. And what I'd like to compare that to is we're the size of a large organization.
Try a restart.
And when Excelis or ProAct go out to a new customer, they're usually meeting with 3 people. the CEO or chief executive officer of an organization, the head of human resources, and a benefits manager or a few benefits manager. Right now we have 50 benefit managers who are all calling the Excelis, Beth, Terry, or Corey, and managing that has become, I would say, a little difficult. So we're trying to funnel things through the consortium so we can help you answer your questions, but Excelis and ProAct will also be helping you streamline how you get answers, because clogging up phone lines and leaving messages and following up on emails can get frustrating for all of us. And we want to make sure you have the answers you need when you need them. So we'll be covering a lot of that today. The other thing we're going to tap into quite a bit today is the consortium website and pointing you to where you can find information. Deborah and I get a lot of phone calls with people saying, where is this? I don't have that. And we usually ask them while they're on the phone with us to pull up our website, and we walk them through where information is located. And usually we hear a big, oh, I didn't know it was there. I didn't know I had access to that. So we're going to try to tap into that a little today, so you can be better equipped to manage those questions that are coming in to you. So we're going to, on our agenda today, which was attached to the meeting invite, we're going to talk about some consortium updates and plan changes for 2021. We will then introduce Beth Miller, and she will introduce the Excelis team for us. When Excelis is through, we will introduce the ProAct team, have them give us updates. And then we'll come back to the consortium. We're going to wrap up with some tools and resources available to you, and then talk a lot about wellness and access to materials and getting information through different digital resources. Although we have time at the end for questions and answers, please raise your hand or barge in if there is something you need clarity on within the presentation. So with that said, we will move to our accounting updates. I'll turn it over to Jessica Hobart, our principal accountant, in a moment. But first, let me remind everybody that the board did make a decision when they were talking about 2021 premiums that we would have a premium holiday in December of 2020, which means no premiums will be invoiced to you for the month of December. Jessica is going to go over some of those details with you regarding the premium holiday. In addition to that, I also want to let you know we do have a new premium payment policy, probably not applicable to a lot of you, but if you become in arrears in your payment on invoicing, there is a new process in place. You'll receive a letter if you've been late 60 days. After 30 days, you'll be charged a 1% late fee. And then at the 90-day mark, you'll be talking to me, the executive director, regarding probably between the 60 and 90, before the 90 mark, you'll be talking to me about expectations regarding payments, you know, what has happened, when will you catch up, and things like that. Those are reported at the Audit and Finance Committee meeting and sometimes jump up to the board level as well. So there is a new policy on that. I won't pull it up and go over in great detail, but I did want to let you know that. So with that, I will turn it over to Jessica, who will cover what the premium holiday invoicing will look like, and then go through some other information as well.
Okay, hi everyone. I'm Jessica Hobart, the principal account clerk for the consortium. I've been doing this for about 4 years now. So many of you I've met, many of you I don't know. I see some unfamiliar faces. The premium holiday is something new this year. We've obviously never done it before. But I'll be using everyone except for, and you know who you are, the county, TC3, and City of Ithaca that get billed on the month. Everybody else gets billed a month ahead. So your premium holiday is going to be coming on your December invoice, which will be the next one out for a lot of you, the smaller municipalities. So what it's going to look like is it's going to look a lot the same. At the top of your invoice where I list the premiums, I'm going to put zeros in all of those for, that'll be your month of December. At the bottom where I do the retroactive adjustments, that's where you're going to see any of the adjustments for previous months, because we're still going to be making those adjustments on this invoice. So some of you may see a credit, some of you may actually still have a bill owed. So invoicing is going to be much the same. If anybody has questions on that, feel free to ask. Again, the rosters, next year I'm going to be doing something new. I realize it gets confusing, especially for the new groups. That front sheet that I sent with the Excelis roster. I'm going to starting with the second sheet. So in the top left-hand corner is where your plan number will be. I don't want to send anything with that Excelis amount on it anymore, because I did have a few municipalities paying that to Excelis and things got a little messy. So other than that, I guess nothing new really for all of you. It's going to be the same thing. Expect that premium holiday. Again, I just want to put out there, make sure you're checking those rosters with your invoices, because catching problems sooner rather than later are a lot easier to get fixed.
Are there any questions for Jessica? We think Jessica will get a lot more airtime with some of the newer entities. A lot of you on this meeting have been with us for a while and have been using the same routine for a while. So I think not as many questions as when we get to some of the newer groups. But as you heard, Jessica will be on the line until at least 10:20 and then join us again. So if you do have any questions for Jessica and you come up to mind later, let us know. All right, so I'll move on to some of the other changes that are going on right now. Premium equivalent rates and summary plan documents. Every year we're asked, what are my rates? As soon as the board or at the September board meeting, when we approve rates, a rate spreadsheet comes out at that time, and then it is fine-tuned after the board meeting to make sure we have every municipality accurate. Sometimes we find out a month later that we missed something. So please always look at your municipality to make sure all your plans are accurate and that the premium increase looks accurate to you well before 2021 when you start charging it. But this year we talked about a 5% rate over in general. The metal level plans changed at different levels due to the nature of the metal level plans, and also we'll talk about some of the other changes that happen to the metal level plans. But so you know, you may be asking, where can I find these documents? So if you go to the consortium website, which of course I'm not going to right now, so let me stop sharing and actually go to my website. Okay, this is our website now. So if you want to find out where the premium equivalent rates are, there's you're looking on the employee retiree and wellness plan information by municipality, and then right here we post the next year's premium equivalent rates, and it's on a spreadsheet, and it's broken down by tabs, cities, towns, counties, and you can click on that and find all the information. In addition to that, if you're looking for summary plan descriptions specific to your location, you can click on your municipality. The plans that are available to the members of, to the employees of your municipality are listed. And then you can click on and see the benefit summary. So this information is always available to you. Now, I'm gonna ask you to be patient because we have a lot of changes that are going on, and Excelis is updating these daily and on a regular basis. And these will be posted by the end of the year, but some of you are doing benefit meetings, open enrollment meetings, and you may need a new summary. Please contact us and let us know, and we'll put yours at the top of the pile. Because as you see, this is the benefit summary through 2020. And as we talk about these benefit summaries, we'll talk about the specific changes that have happened. And that has to be updated line by line. We have to go through it with a fine tooth comb. We have to sign off that we agree, and then Excelis will post them. So it's quite a process, but this is where you can find that information. So it's your premium equivalent rates and your summary plan descriptions all here on the website under plan information by municipality. So if you ever want to know what another village or town or city is offering, you can always click on them and see what your friends are doing as well. So that's where you can come and find that. Okay, so that's premium equivalent rates and summary plan descriptions. Beth, how soon do you think we will be able to post the summary plan descriptions? You're on mute.
There you go. What happens is after we process the renewal, then and we have the signed benefit grids, then I release the actual benefit summaries. Those are the employee facing summaries over to the consortium for the posting onto your website.
And I'm sorry, did you say a timeline?
It happens after the renewal is signed.
Okay.
I have those benefit grids. I can release the benefit summaries. I know we did approve the meta levels because we discussed those earlier. So I did, upon request, I believe Sunday actually had an open enrollment that she was requesting them. And I think county also.
Okay, great. All right. So that's where you can find that information. All
Elin,
right. So let's.
and this is Beth again, Elin. Quick question. Has anyone gone out and like utilized the consortium website and really, you know, bounced around, because there's a boatload of information that is out there, and just clicking on the few things that Elin just brought up is a game changer, especially when you're looking for your rates and you're trying to get ahead of the open enrollment coming at us. So I love the website.
Thank you, Beth, for that unsolicited promotion. Judy, did you have something you wanted to say?
Yeah, I just want to point out that on the Blue Cross benefit summaries, if you're looking at the RX side of it, it's going to show that there's no coverage because Excellus cannot put in the prescription side because that's coming from ProAct. So you may need to attach something else describing our prescription benefit plan along with this, or you're going to get a lot of questions about not having any prescription benefits.
Thank you, Judy. That's a great catch. We do have that on the website next to the summary, the plan summary. It says if it's 5, 10, 35, or whatever your prescription plan is along with that. So it is there, it's just not on that summary. But don't tell Beth, we may add that to the summaries once we receive them from her. We'll see what we can pull off this year. So let's talk a little bit about the plan changes that have happened this year. Also, I'm not going to jump to the website for every single one of these. I'm going to talk in general about a few of them, and then we'll jump over to the website. We are removing a bunch of old plans. So I don't want anyone to be alarmed right now. The plans that we are removing that will no longer be available are plans that nobody is currently enrolled in. So there is a laundry list of those plans that will no longer be available for selection as part of the consortium. And in addition to that, there are a few plans that you may have and may be continuing to use, but we are not going to let new municipalities go into those plans. Those are some of the plans that we feel there's been movement to the middle level plan, administration, competitive nature of the market, that we should probably eventually move away from those plans. But because you have negotiated a contract or something like that, you're still holding on to those plans. So they're listed there as well, but you're not asked to take any action at this time. So we are removing some plans, and they're the older plans. There are also some of the Medicare supplement plans that nobody's ever picked up. There are some middle level plan changes, and that is every year we do have changes to the deductible and out-of-pocket levels due to compliance with the actuarial calculator. And in order to remain in compliance with middle level plan specifics, we discuss those changes with the joint committee, and then the joint committee submits their recommendations to the board. Losi and Cahill are very helpful in doing the calculator for us and advising us on how we might want to change plans. So I'm going to move over to the website so that we can look at where those are located. So if you go to governance and the board of directors, all of the action that has been taken during the year is under actions and resolutions. And if you scroll down throughout the year, you will see some of the amendments that have come up and that we're going to talk about this morning. So here is approval of adjustments to the bronze, silver, and gold medal plans. So the resolution is what the gold, what the silver, and what the bronze, where they were in network to what they will be. So you'll see those slight increases, the adjustments that we had to make to remain in compliance. So gold is at between 78 and 82%. Silver is between 68 and 72%, and bronze is between I think bronze is between 63 and 67. I think it's around 65% to be in compliance. So those are the tests that we went through, and the out-of-pocket, the same, what the out-of-pocket went from and to. So this is where you can go back and look at any of the changes that happened. You are notifying, so how are employees notified of the changes? Employees are notified through their employer. So that's why these meetings are put together, is so that we can inform you of these changes. These changes will go on the summary plan descriptions, which will be on the website. But these meetings are specifically to let you know about the changes that have happened so you can notify your employees. Thank you for using that chat function. Are there info sheets? We can send you out the resolutions if you'd like the resolutions, because I think the resolutions are pretty straightforward. Or, you know, if it's the request of this group to present them in a different way, we would be happy to present them in a different way, but they also will come on the summary plan descriptions. Okay, so the next changes, also here under resolution, was adjustments to the out-of-network deductibles. Our out-of-network deductibles have been 2 times what the in-network out-of-pocket has been. So there was a recommendation that we changed those to only be 50% higher than the original out-of-pocket maximum. So for each of these plans, you can see what the deductible is, which was the new deductible, and the affiliated out-of-pocket maximum. So there are 2 changes to the plans, was the original deductible, and then this switch to the 50% out-of-pocket maximum. And then the next and final change is the addition of adult eyewear and adult hearing aids to the metal level plans. So there was no benefit previously regarding hearing aids, and there was no benefit previously regarding adult eyewear. As a result of talking with new members and doing plan comparisons, we felt we were a little out of the market when it came to being competitive in these areas. And the recommendation was made once again through the joint committee to the board to add hearing aids to the metal level plans and eyewear. So the benefit is spelled out here for you, that it's a 50% co-insurance subject to deductible, whether it's in network or out of network. And on hearing aids, it's 1 purchase every 3 years up to a maximum of $3,500 value for 1 pair. And this limit is combined, whether you go in network or out of network, it's a combined benefit. So you can get a hearing aid benefit every 3 years for $3,500. And I understand prices of hearing aids are going up in some areas, but also there are coming down. There are some large brands that are carrying more cost-effective hearing aids that this may not cover all of it, but will cover a significant amount of it. And then the adult eyewear is pretty straightforward, that adult eyewear is now covered. with a $60 reimbursement per year. And that includes frames, lenses, contact lenses. And once again, combined for in-network and out-of-network. For those of you on the bronze plan, you did not have any hearing or vision benefits. So this is adding all of the hearing and vision benefits to be in line with the other metal plans. So it's adding that. And then also the Medicare supplement has a different coverage that is traditional in the marketplace, and Excelis helped us create this one. So for the eye exam, it's a $20 copay under the Medicare supplement plans. I wear a $100 allowance for lens, contacts, and frames. And that has to be done at the same time. Also, hearing aids, 50% up to the $3,500 under Medicare supplement. Okay, so those are all the plan changes that the consortium has approved. So if you want to go back and look at those details again, you can certainly call Deborah or myself, but you can also find them right under here, under the governance tab, board of directors, actions, and resolutions. Okay, any questions? Perfect. So we just went through these. All right, and then there's only, I guess because the government was so distracted this year with COVID and giving us new government mandates regarding COVID coverage, they only came up with 2 new mandates this year. The first is the anthrax vaccination. Anthrax was already covered under the Affordable Care Act as a preventative service. And as of 2021, there will be a booster available done every 3 years. And that booster will be covered the same way as the initial shot is covered. Then there is a change to diabetic insulin to the out-of-pocket maximum. And the mandate is pretty strict for a 30-day supply of insulin. A diabetic patient will only have a $100 out-of-pocket cost for in-network 30-day supply. And I didn't know, Corey, if you wanted to add anything, since PROACT will be covering that, if you wanted to add anything regarding the coverage of the insulin.
Yeah, thanks, Elin. So I think 2 things, right? One is that it is a maximum. So people that are paying $30 today, there's really no changes for them. They're going to pay their copay. This is really for members that don't belong to such a rich plan like the consortium that have, $200, $300, $400 cost shares associated with insulin. And the other thing is thinking about it more. This may become confusing because there are so many injectable diabetes products today on the market that are not insulins. We have to remember that this is specifically for insulin products, the big ones being like Humalog, Humulin, and Novolog. But there are certainly a large number of other diabetic injectable products that are not a part of this mandate. Again, those people are still going to be paying their copays. If they're in things like the bronze plan, they'll have the deductible associated. But those products are not associated with the $100 maximum mandate put forth for 2021. So those are really my only 2 things to add.
Thank you, Corey.
Sure.
Okay. Now, some of you at the local level have made your own plan changes. in that you are maybe offering a Medicare supplement to some of your retirees that you have never offered before. Maybe some of you have people electing to go to the Platinum plan, or people who are out on furlough that are coming back to a different plan. Most of those plan changes are being handled at the individual level. I think you know who you are. But if there's anyone on this call who thinks they are changing from a bronze plan to a gold plan, or from a gold plan to a platinum plan, and you have not notified the consortium, today's your last day to do that. So all of our new municipalities that are joining us next year need to let us know what plan they'll be entering today. And any of you that are making any other plan changes need to notify us today of your plan changes. One of the reasons you need to notify us now is once we're notified, we notify Excelis and ProAct, and Excelis and ProAct start building the new group under their administration. And once they build that new group, they can then move your employees at the beginning of the year, or your employees can elect it. They're set up in the system so you can key them in for the new year. And then also so your employees can get new ID cards by January 1st. So please, if you have any plan changes that hasn't been confirmed by the consortium, so you're wondering if maybe I have it or don't have it, if you haven't received some kind of confirmation from me, please get back in touch with me and let me know that you are looking to make a plan change for 2021. Anybody have any questions about that? Okay, then we will move on to the Excelis part of the meeting. And I will turn it over to Beth Miller, and Beth will introduce her team and take it from here. So Beth.
There we go. Can everyone hear me? Okay, great. So I'm excited to be here and going over some of the things that we have to talk about. You're going to see a lot of tools and tips to help you navigate Excelis Blue Cross. I know many of you have been with me and Terry and myself have been servicing the consortium since the very beginning. And some folks I've seen for many, many years. So welcome, and I'm really glad we're having an opportunity to kind of just reset, level set of different avenues and tools and resources that Excelis has modified and updated over the years to help you coordinate with us when you have questions. So with that, I'll turn to the next page. Kind of an overview. I have Terry Godfrey, who is our account service consultant. She's my partner in crime. We work together on the consortium. She is a very integrated part, works a lot behind the scenes, but is always right there in my right arm. I also have Jason Warshall, who will be talking later in the presentation surrounding all your wellness and health, well-being activities, and works directly with the consortium and the wellness committee to really help that avenue when we look at health and wellness of the consortium and its members. We also have Eric Kohler, our membership and billing team. He heads up a large population of membership and billing members, and he's going to be going over some ins and outs of membership and tips that will help you navigate some of the questions that you have probably on a daily basis. And the real nice piece is he's going to go over how to find those information quickly and to navigate the system to be able to answer questions confidently when you have somebody who comes in your office and perhaps says, oh, my mother moved in with me and I want to cover her because I'm fully responsible for my mother. So direct access on how to answer those questions with confidence. The other person that I have joining our call today will be Libby Banis. Libby Banis is our online web tool engineer, so to say. She actually works with a lot of our groups in going over the ins and outs, tips and tricks of navigating our online tool. So she's going to show you and navigate around the online system. So that's kind of the team today from Excelis. The overview that I kind of wanted to just run through, and I think Elin actually made a comment that this has been a strange, challenging year, to say the least. In March, we had something hit our communities and we've never seen before, and that is COVID. So it took us all by surprise. We're all learning and navigating it together. We're working at home. So I just kind of wanted to bring us a step back. We're almost, 6 months into this now. As we look back, we at Excelis had email saying, okay, this is what's happening. We're all going to start working from home. So we have our entire workforce working remotely, and it has been an amazing journey. We did not miss a heartbeat. We were able to bring all of our people online, access, and keep work flowing. So that was a real pat on the back for all of us. The fact that we had a plan in place, that we have been working from home in and out, but to have an entire workforce working from home and having a system that will be able to handle the work from home connectivity was amazing. So we are still at home. We're working remotely. There's only very few critical personnel that are actually in our Blue Cross building. As of right now, the plan is to work at home remotely right through January 2021. And then our corporation will evaluate the COVID and the pandemic as to where we are with the state of emergency. So just as a deep breath, I like to think about how far we've come and the fact that we're all in this together and we're working through it. It's a challenge. It's a challenge for the consortium. It's a challenge for each and every group that we come in contact with. So the fact that we're working through these challenges together is an exciting time for all of us. So congratulations to all of us working through this. I know some of you are actually back in your offices, maybe full-time, maybe part-time, but all of our clients are in different phases with the pandemic. So knowledge is power, isn't that what they always say? I always think about, I want to be informed, I want to know what's happening, how do I do that? So when the coronavirus hit in early March, we created an entire piece within our Blue Cross and Blue Shield website dedicated to the coronavirus. So when you log on, there is a blaring notice right in the top middle, and you can click on it, and it has the most current information surrounding COVID. There's also our newsroom releases. There's a section on testing and coverage policy. We've had lots of questions on my kids are going back to school. I have a daughter, a son attending college. The college is telling me they have to be tested. There's a whole piece on that. Testing coverage is not covered for the pandemic. Just so everyone's aware, if you do have signs or symptoms and your doctor says you need a test, of course, go get the test, it's covered. But if you're if you work at a nursing home or you're a fire personnel or police and work is saying that you need to have a test, that would not be covered through the health insurance. So a whole piece of information surrounding COVID is right on the website. There's also member support tips in, what happens if you feel symptoms. It talks about social distancing, when to wear a mask. There's a lot of useful information out there. And there's also our business and broker resource tabs that also has a slew of information. So we have Terry Godfrey McPherson on the phone. As I said, she is your strategic account consultant. We both expect to be working from home till after the new year. We want you to utilize us for group questions and concerns. I think what happens, sometimes you have people coming into you and they have a claim question, or they're asking a specific question. I'm going in for an elective surgery. Is this covered? I have to have a pre-auth testing. Is this covered? So they're asking specific questions. Members should always be calling the ID or the looking at their identification card and calling the phone number, which is our customer care number. Customer care has hours that are open. They also have online access that you can question something. But the big piece is when our customer care is actually answering a question, they are researching the tools and they are documenting their response to the member. So as much as you may think, oh, a surgery's covered, you don't know if they're going to a participating provider, a non-participating provider, if there's balances. That's all discussed between the Excelis customer care representative and the individual. So I encourage you to point people to their ID card and the number on the back of their ID card. And truly, we're trying to meet everyone's needs during these challenging times. So as I said, we are at home. Our best means is to use our email. However, all of our phone messaging is coming directly through our email. So if you do call our phone number at work, we have the technology to have the actual voice recorded message sent to our email. So we feel strong about having you covered in making sure there's still connectivity during this challenging times.
Beth, I'm going to interrupt you. This is Elin. I have a question from the floor, which I think is a great opportunity to talk about one of your resources that are available to us. Someone has asked a question. They have a married employee that is currently on their parents' policy. Their spouse will drop off their parents' coverage in March. Do they need to enroll as of January 1 with a family policy, or is this considered a qualifying event and they can be added in March? So I think there's two things here, or maybe even three. One is the spouse of a dependent covered under our plan?
So speaking from the very first question, you have dependent coverage to age 26.
But what if that dependent's married? Is their spouse covered?
No. So the dependent would be covered. The spouse of the dependent would not be covered under the plan.
So because they're not covered, it's not considered a qualifying event, so we wouldn't add them now. And we also wouldn't add them during open enrollment because the spouse of a dependent is not covered.
Correct.
Okay, so as you see, I am now on the consortium website and I am under municipal resources. And I'm going to the Excelis Administrator's Guide. This is a fantastic tool. And one of the things this tool tells you is eligibility. Who's eligible? Now, I'm not going to go through all the pages, but I'm showing you in the future for people who have similar questions, it will tell you who are eligible dependents. This book is available in hard copy. We are happy to mail one to you directly, but it's always here online as well. And when Excelis updates it, we will update, they send us an electronic feed and we update it on the website. So just wanted to show this to you. And for the person who asked that question, if we didn't answer it properly, let me know through chat. But also letting you know these resources are always available to you right here. And I encourage you to use them because I've been scolded many a time by Beth for not using this resource. And I have been caught off guard with some of my answers. So this is my new Bible in regards to benefit coverage.
The reason I do love the guide to point to, it's not somebody walking in asking you a question and you saying, well, Beth told me this. You actually have something to point to that's concrete. So it's a nice say right here, even if they email you and then you can copy paste it and send it back, these are the guidelines. And it's official and you have something to refer them to. So it also helps credibility, and just when you're answering something word for word, you can take it right out of the book. And I've done that too, word for word.
Yeah, and don't hesitate to call us. We're not saying don't call us just because you have this resource, but it's a really good thing to go and look at first and then call us and say, I read this on page 14. Am I correct? A spouse of a dependent is not covered. Also, a child of a dependent is not covered. So, you know, there's a lot of things you can learn by reading that. Okay, Beth, I just want to let you know you're about halfway through your time slot.
Okay, because I'm just wrapping up right here. As I said, the member has their perfect safety net, their identification card with the Blue Cross Blue Shield symbols. People love that card. They hold on to it. It's in their wallet. It's in their purses. They pull it out when they show and they have services. The customer service number is right on the back. The website access is also there. And I'm pretty sure that Elin also has that website connectivity from the consortium's website that links right over to the Excelis for the member to log on directly to their own account. They can actually see their own benefits. They can see a high-level summary of their benefits if they want to know, oh, if I go into the hospital, do I have a co-payment? If I go to the urgent care, what's it going to cost me? It talks
It also calculates deductibles, flexibles, not flexible spending and claims. You can access your documents. You also have an opportunity to house all of your documentation, such as your monthly health summaries. If you had to have prior authorization for surgery, it is also can be housed right there. It's just a great tool to get on and to have that information at your fingertips.
And please note that when you're on the Excelis website and you're looking at your deductible or out-of-pocket maximum, that is only medical. It does not include ProAct expenses. So a lot of times I get a phone call, I've used up my HRA card, but my Excelis deductible is only at X. That's because usually the difference is how much you have spent on ProAct. So when we hear from Corey in a minute, we will be hearing how you can find this information on the ProAct website as well as the Excelis website. You do have to do a little math at that point.
This is Libby Banis. May I add just one sentence to this?
Sure.
Yes.
We also have a terrific mobile app. And as I'm listening, I'm thinking if you would like to set up some kind of session, or I can send to you some links, some good material, I would really make sure that your employees know the benefit of having an account for our websites, but also download the mobile app. Your ID cards are at your fingertips. So if you accidentally leave your cards at home, it is not a problem. They're with you all the time. And as you mentioned, we also have some other tools that are very helpful. Benefits, claims. We have a cost tool where they can look up an elective procedure and get an estimate on the timeline for the procedure, the out-of-pocket expenses, and it actually uses the policy's benefits and current status of out-of-pocket expense. Again, that's something we wouldn't have time for today, but I'd be delighted to help you by putting some materials together or presenting either directly to your employees or however way you would like to handle it. Thank you.
Libby, I'll just back up what you just said. My children live in other states and are used to call me on a regular basis and say, can you send me the ID card? They now have both downloaded the app and I haven't heard from them since. I know they're each seeing the doctor because it comes up in the summary on my thing. So it's nice to know that it actually works to download that app. They don't have to call you for their ID card.
Right. My husband's the one that leaves his cards home, but yes, it's fantastic for our children off at college. It's absolutely terrific. Thank you.
Great. And Sarah Thomas would love what you're advertising if you didn't see that message. Okay, I'm going to restate the question that was brought up. There is an employee who's 25. As we know, when you turn 26, you drop off your parents' insurance, which means she is now she is no longer eligible to be on her parents. So she needs to come over to her employer's insurance. She turns 26 in September. So how do we handle her? That's a qualifying event, correct?
Correct. So she's coming off her parents' policy because she's turning
Nope.
26?
Yes, correct. Who are not employees of ours. She's the employee.
Right, so that she would be off her parents' policy and now she needs to sign up under her own coverage.
Correct.
Then she would complete an application at that time and she would be individual on her own for herself.
Correct.
And her parents.
And they can also do that off our website as well. Because again, younger kids tend to be more electronic, and we want them to be.
So they'll have to enroll though through their employer as a qualifying event so they can come on board in September. And then when her spouse turns 26, he would then be able to join. No, he would have to switch in January because he wouldn't have a qualifying event.
The loss of coverage would be considered a qualifying event. So let me make sure I'm following this correctly. Right now, the dependent is covered because she's under 26 under the parents. She works at the municipal client or the entity. So she will come off in September because she no longer qualifies for coverage under her parents. She will start her own policy, and her husband, who's still under 26, soon to be turning 26, is covered by another insurance under his parents. When he becomes no longer qualified because he's 26, then that's considered a qualifying event. And the daughter, who now has her own coverage, can change from individual to family and add her husband. Is that what you're asking, Elin? I just not trying to
Can I ask the question?
Yep, go right ahead.
Okay, sorry. So the question, her husband turns 26 before her. So he will lose his coverage this March. So should she get a family policy now in January, even though she's not 26 yet, so he's covered, or should she wait until March? Because does his turning 26 make it a qualifying event?
Eric, I just want to.
Yeah, so Beth, what I heard is, so open enrollment, and I had that down, but open enrollment's the one time a year that really anyone can join the plan. So January 1st, it sounds like that employee hasn't lost coverage. She has coverage under her parents' plan still, but she could hop on during open enrollment, and then she would kind of have dual coverage, right? So she would have coverage as an employee through the plan, and she would also probably maintain her parents' coverage as well, and we could do a coordination of benefits. But it sounds like that she would come on during open enrollment as an employee, and then once her husband loses coverage in the future, she could use that as a qualifying event to add the spouse in that case, because loss of coverage, and that's involuntary loss of coverage, aging off the plan. The difference of things that don't create a special enrollment period would be a voluntary loss of coverage. So if they voluntarily said, I just don't want the coverage anymore, that wouldn't be a qualifying event to add another plan, but aging off the policy is considered involuntary. So I would say yes, she could come on during open enrollment, and then once the spouse loses coverage in the future, that would be a qualifying event to add to the existing policy.
Good question. Thank you.
I have another question, and if we have to come back to this, let me know. Is there a place to look up what constitutes a qualifying event? I didn't see anything in the administrator's guide. I believe it's in there. If someone could find the page and let us know.
Yeah, Ian, so this is Eric. I have in the PowerPoint that I sent out, I took out the page numbers because we are getting to the final stages of having a new guide available. And as soon as that is published, we will share that. It's getting towards the final stages, ready for publishing to our website and the paper booklets. But I can look up the page number. A lot of what I had in the PowerPoint was about special enrollment, what qualifies and what doesn't, but I can grab the page number from the current guide for sure.
Okay, and one more question before we move forward. And Sarah, I can give you the information you're looking for. Under a qualifying event, would they have to provide proof that they are losing insurance?
We do not require proof, so we would just require the application. We don't require and we don't issue certificates of coverage anymore, so we wouldn't require proof unless there was some question of retroactivity and things like that. If it had to go for secondary review, there might be additional documentation or proof, like if it's beyond the 120 days of retroactivity allowed and it's going back 6 months or so, at that point we might require some additional documentation. But Terry, you agree, I think we don't require any documentation for loss of coverage, just an application signed by the group administrator.
We do not require proof.
And we will talk about the consortium and what we require a little bit later regarding dependents, but we will follow Excelis on this rule. Okay, great. We will move forward. I've put up the next slide.
Yeah, I can hop right into this. Thanks, everyone. I'll try and move pretty quickly through these because we touched on some of them already. So initial enrollment, we kind of talked about some of the scenarios already for this one. If someone's a new hire or rehire, they are able to hop on the plan if they haven't had coverage before, as well as a newly eligible dependent. So in the case of marriage, birth, adoption, the latter two, adoption and qualified medical child support orders, are a little bit more complicated. Just a little bit more paperwork and some scenarios that could be there and what things are needed for that. But those are the initial enrollment opportunities, right? So if you hire someone or they leave and they come back, it's a rehire. And then if someone is a newly eligible dependent, those are three kind of initial enrollment qualifying events. So we can move on to the next one. And then open enrollment, we kind of talked about already. So January 1st, that's the one time of the year that pretty much anyone can hop on the plan if they haven't had coverage or in the past and they want it now. So benefit changes are generally restricted towards the open enrollment period, but there's other qualifying events or things like that throughout the year that can also happen. And then voluntary disenrolls. So dependents and folks can voluntarily cancel their coverage every year from our perspective. But if they do so mid-year, they can't hop on unless it's open enrollment again or they have a qualifying event. And we can move on to the next one. So special enrollment period, this is kind of where we touched on already just a little bit, and some of the scenarios are always good to discuss, and it makes us think about it because there's a lot of moving pieces, as we can see. So a special enrollment period really is, a time that you qualify for enrollment throughout the year outside of your open enrollment period. So kind of like we talked about already, involuntary loss of coverage is a good example. So if you're aging off your parents' policy, you're not choosing to do that, right? You've reached the maximum age. So that's an involuntary loss of coverage. It's not by choice. So that would qualify for a special enrollment period. And some other things as well. So moving in and out of the service area, if you lose eligibility for a government sponsored program such as Medicaid, there's a qualifying event to add on if you lose eligibility under another program. So events that do not create a special enrollment period, if you voluntarily choose to end your coverage, if you choose to end your COBRA coverage or COBRA coverage is canceled for non-payment. And then an example here that is from the administrator guide as well as the spouse's employer raised the contributions, employee contributions, but they didn't cease contributions. So there'll be some examples like that in the administrator guide that we can send the page numbers out to. So special enrollment periods are really for involuntary loss of coverage and some other events throughout the year. Ineligible subscribers, contract employees, and temporary employees are not eligible subscribers. And hop over to the next one, eligible dependents. So eligible dependents, this is a section in the guide too, and once we get the updated page numbers out, we'll send those out. The spouse is eligible dependent, children of the subscriber. So natural children upon birth, at open enrollment or with the qualifying event, and then stepchildren to when they can be generally added, a proposed adopted child and an adopted child. So there's a little bit criteria there. To legal guardianship as well. So those ones, we might require a copy of the court order, and there's, differences between legal guardianship and custody. One doesn't necessarily constitute the other. But if there's any questions, and Beth, Terry, and I can always work back with our underwriting and teams to come up with a solution or answer for you. But eligible dependents, you know, spouse, children, legal guardianship, adopted children, domestic partner, adult disabled dependent. So we require a separate form for that one and medical review. But say if that 26-year-old is reaching the maximum age of the policy, but they're an adult disabled dependent, they could complete a form and have coverage either approved permanently or temporarily on the employee's plan as well.
Okay, Eric, I have a question for you.
Yep.
When you lose coverage, so you're on another plan and you lose coverage, and you want to enroll under your employer's or insurance, do you have to do so within 30 days from the date of termination of insurance? So how many days do you have from a qualifying event to enroll?
So generally we do ask that you let us know within 30 days. That's just the standard time frame. We do have 120 days of retroactivity with this group here. So we can go back 120 days. If for some reason something was missed. Beyond that would be a separate process that we would have to initiate for retroactive review behind the 120 days. But Terry, you would agree with that as well, right?
I do agree. Mm-hmm.
Yeah, so 30 days is kind of, that's best practice, just so we don't negatively impact like billing and things like that, and we don't have to have too many retroactive adjustments back and forth. So 30 days is the best practice, but 120 days is standard retroactivity for this group here.
Denise, I do, this is Terry. I see your question, and that's because only our self-funded employer groups have a retroactivity time period of 120 days. So if we were to allow that time frame on the web, we would have all of our fully insured groups potentially utilizing that as well. And that's where what Eric referred to as the retroactive exception, which is where we have to go to underwriting and say, is this, you know, will you approve this retroactivity? So ultimately, that's why it has to come to me. Did I answer your question?
I'll get back to you on it, Terry.
Okay. All right.
Yeah, I had that as a note to mention too, that the Excelis web portal allows current activity, but for retroactivity up to the 120 days or beyond, we utilize Terry to get those added through the systems.
Yeah.
So ineligible dependents, in the scenario before, it sounded like it was a son-in-law or daughter-in-law. So that would be another example of an ineligible dependent like we discussed. Grandchildren is another common one that we get asked about. Unless the grandparent adopts the grandchild or becomes the legal guardian of the grandchild, grandchildren are generally ineligible, as well as foster children, and then children over the contract age limit unless there's a disabled dependent form. Spouses, if there's a divorce as well, we want to get those former spouses removed from the policy.
Eric, this is Terry. I would like to ask a question that came in from another group, just for everyone's perspective on this. It was a situation where an employee's parents ultimately have green cards, and they are the employee rather is responsible for them financially, and they do I don't know what we want to call it, register on them on their taxes. So ultimately the question was, would this employee be eligible to cover her parents on the policy?
That's a good example. So I've been doing this for almost 10 years now, and I get new scenarios passed to me every day. So that's a good one. And in that case, I'm going to work with our underwriting management team so I can check and see, right? So everyone does their individual tax returns. It's up to them how they file or how their tax professional does that. But I'm going to check with our underwriting management team and see, and I'd be happy to share that that guidance with this group as well.
Okay.
That's a scenario where they seem to be financially responsible for them as well. So
right, and it was ultimately a new, as long as I've been here, that was a new question for me. So yeah. I appreciate it. Thank you.
Yeah, definitely. So
Okay,
this slide,
Eric.
yep.
Eric, another question. Can a member add a disabled dependent if they become disabled after they age out?
So there is guidelines on that. I'm not sure if I've included them. I'm just looking ahead here, see. So there is a time frame. If you wait until 6 months after the person has aged off the plan, that's too late. Generally, I believe it's within 60 days of aging off the plan, but I can pull that additional. I think that might be in the group administrator guide as well, but there is a time frame. So you wouldn't want to wait too long. Ideally, we would have that before they age off, because our contracts do specify an exact time frame on when to apply for disabled dependent coverage. And kind of what happens here, this is a good slide for that actually. A dependent loses eligibility. So when someone's reaching the maximum age, there are notices that go out and eligibility will stop automatically. So once, it's important to look at those notices and know who's aging off, and if they are disabled, to get those forms completed as quickly as possible. And the disabled dependent form would have to be signed off by a physician and go through medical review. So in those cases, you want to get that process started as quickly as possible.
And then just on a sidebar, I would like to mention that review is conducted by a physician. It's one of our medical directors, our actual MDs. So they review the medical notes and make the determination based on, you know, their level of expertise. So.
Yeah, and I saw a question pop up about, can we get a summary? So generally a group summary goes out and a subscriber receives a notice who will be aging off their policy. So that's our standard practice. I don't believe we've changed it for this group here. So there should be a group summary notice and a subscriber notice that goes out. If it's not being received or there's any questions about that, we can look at that for sure.
Terry, can you review where that goes and let me know? Because I don't get a summary. So can we find out where that goes, that summary goes?
Absolutely.
Okay, thanks, Terry.
You're welcome.
So we can hop over to the next one. Probationary period, I think we're all good on this one. It's the amount of time that someone has to wait before they can hop on the plan. So if you're a new hire, there's a probationary period that generally has to be satisfied in most cases before they're eligible to join the plan. COBRA, we kind of touched on as well. Unless there's specific questions about COBRA, we can hop over to the next slide. And there's some time frames on here. So generally for COBRA, we allow a larger retroactive time frame with kind of no questions asked to adopt, because there's some premium payment and things like that. So we touched on retroactivity up to the 120 calendar days with no additional processes that need to take place. And then the impact on billing, right? So it's important to pay as billed. If enrollment activity gets processed after the bills generate, that won't appear onto the next invoice with debits or credits. So just working on getting the enrollment in as timely as possible will prevent some of the retroactive adjustments on the bills. And if you need to know what day of the month the invoices generate, that will be on those invoices. I'm sure Terry and I could look that up and share it as well, because it should be the same day of every month. So if you submit a web transaction, if your group bills today and you submit it tomorrow, it's going to be it won't be reflected on the current invoice. It'll be reflected on the next invoice.
Yeah, I don't know if Jessica's on the line. I think for us it's around the 13th to the 15th.
It is. Our bills print usually on the 13th, so.
Yeah, you're gonna miss if you get in after that.
Mm-hmm.
Yeah, so October 13th, we would bill for November. Any questions on Medicare? We can probably pass through these slides pretty quickly, so you might get over to Libby. Medicare, joining with this group here, we treat everyone as over 20 employees. So if you're working aged, in those cases, the plan would be primary and Medicare would be secondary. So it would be MSP rules apply for 20 or more. So we can pass through this slide and the next slide. So the group maintenance guide, the county and the group website have the group maintenance guide referenced on here. So we have it posted to our website as well. Once the new iteration is out, we'll have it posted to our Excelis website, but the consortium website will have it too, and Beth will push those updates. So we'll get that out hopefully within the next few weeks. It's getting towards the final stages, so you'll see a refreshed edition with some new information as well. And I think that's it for me. The rest of the slides were just info where you can get forms on our website and some pictures of what the disabled dependent form and qualified medical support order certification forms look like. But if you have any questions, I'll kind of look through the chat, or feel free to reach out at any time. Thank you.
I just got a question. Would the slides be emailed to everyone? I would like to have it, as well as a recording to listen to afterwards. The answer to that is yes. We are now recording all of our Zoom meetings, and by we, I say the consortium is now recording all of our Zoom meetings, and they will be posted shortly to our YouTube website. So after today, we can send out to everyone a copy of the PowerPoint. It is a huge file, so we may have to figure out how to send it to you. We'll have the information also available on our website. So we'll have the hard slides, the YouTube channel of the meeting on our website. So thanks for asking that question. That will continue to come.
Sarah, this is Terry. I'm just confirming, are you and Sunday are not receiving age off notifications? Is that what your question is?
Yeah, we're not receiving the dependents aging off notification.
Okay, thank you.
Members turning 65. Yeah.
Okay, thank you, Sarah. Thank you, Sunday.
I know Judy is receiving it, because when my child aged off, she sent me a notice. So I know the town of Ithaca is getting it. Okay. When would COBRA start for a terminated employee if they opt to enroll, say, 60 days after termination? So what we're saying, are COBRA rules different?
The COBRA usually begins, unless it's a very rare scenario, COBRA would begin on the date that you lost eligibility. So if, say, employment was terminated today, COBRA would begin retroactively to the date that you lost coverage without a gap, unless it's a very rare scenario.
But what if they don't notify you they want to enroll until 60 days after termination? What is the cutoff for them to enroll in COBRA?
Yeah, so that's pretty common, because generally with COBRA, there's more forms that need to go out and election notices to meet the government guidelines. So 179 days is standard practice for that we allow for a retroactive notification for COBRA. So that's a little bit more than the 120 days. Subscriber events would be 179 days, or if a dependent is qualified for COBRA, we allow up to 239 days of retroactivity. So it's pretty extensive for COBRA notifications to reinstate coverage without a loss and without a gap.
So Elin, my question kind of goes back to the aspect of paying for COBRA. If somebody's terminated and they lose coverage, say November 1st, and January 1st, or I don't know, December 15th, they decide they want to go back on, they want to choose COBRA, they have to go back to the date that it got termed, right? They can't pick it up starting December 15th.
Correct. Yeah, I think the rare scenario that I've seen from the Department of Labor is if they waive their coverage and then they change their mind, but you would have to have a signed waiver and then changing their mind. So generally, yes, COBRA goes back to the date, and we allow such extensive retroactivities because there is that payment piece and COBRA notices that has to go out. It does take some time to send out the election notices and then collect payment and then get the system updated. So that's why we allow such large retroactive timeframes for COBRA.
Right. That's what I thought. I just wanted to check.
Great. Thank you. All right, was there anything else, Beth? Or are we moving on to ProAct?
Yes, we're about wrapped up in that section.
Great, thank you. Thank you, Excelis. And now I'd like to introduce Corey Prashaw from ProAct to walk us through the rest of our presentation.
Yeah, thanks, Elon. So really quickly, guys, and you might even be able to jump right into the next slide here. We really wanted to go over, again, Elon touched on it at the very beginning. How do you get a hold of us? What leads to the fastest response? And we know that these are kind of changing times. So maybe how do we navigate a COVID pharmacy landscape, right? So for anyone that doesn't know me, Corey Prashaw, I've serviced the consortium for the past few years now. So certainly understand kind of the dynamic that goes on between the consortium, the benefit managers, and then your guys' members as well. So one thing we know, in just jumping right into the help desk side of things, one thing we understand is the sense of urgency attached to pharmacy claims, right? So pharmacy claims, fortunately and unfortunately, are live. They happen right then and there. So when someone goes to the pharmacy, they're actually billing us, and the pharmacy is getting paid at that very moment. So if the pharmacy doesn't get paid for whatever reason, that's what's going to cause a call to come into you, the benefit manager. That's going to cause, a certain level of concern. Now, the one thing we recommend is that before the member, patient, whatever you want to call the person picking up the drug, before they leave the pharmacy, they call our help desk. Our help desk is available 24/7. A lot of these things are related to, in fact, I dealt with one this morning from a consortium member. The pharmacy said, hey, no, you don't have coverage. They were submitting the person's date of birth wrong, right? Which is something that shouldn't even concern ProAct, that should be available right from the member. But those things happen as pharmacy associates enter in sometimes thousands of ID cards throughout a day. Things get missed. We need to understand that. There are also things on the plan such as step therapy and prior authorization. I will say that in the past number of years, the actual pharmacist level of communication in retail drugstores has gone down considerably. And what happens is the pharmacist makes a decision that the script got paid for by ProAct and the consortium, and they give that drug then to the member, or it didn't. And there's not necessarily the same level of insight that there used to be, where a pharmacist will actually read rejection messages and say, hey, here's why you can't get your script today, and here's our plan of attack. Here's the next steps that we need to take. So again, I cannot recommend this enough. I would say up to 99% of the emails that I receive on a daily basis, not just from the consortium, but through our book of business, could be alleviated if a member would have called our help desk right then and there at the pharmacy, and they could have walked out with their prescription, or at least had an understanding of, okay, hey, I know my drug needs a prior authorization, and that's going to take me 2 days. So I'm going to make a plan to either call the pharmacy, call my doctor, or call ProAct within the next 48 hours, so that we can make sure that the ball's rolling, and that I'm taking the steps I need to get my drugs. Again, our help desk is available 24/7, 365. There's not a day that we are closed, and we promise that you'll speak to a person, either in Syracuse, New York, or Gouverneur, New York, within 20 seconds of dialing the phone. So it's not a long wait that you're going to be sitting on the phone for 20 minutes. And benefit clerk to you as well. If at any point you have someone that walks into your office, they stop to the pharmacy before work and they say, hey, I went to the pharmacy this morning. I thought I was going to pick up my prescription. The pharmacist said that there was an issue. Can you help me out with this? I know you guys are very closely involved with the employees. You can also call that help desk and say, hey, I've got this person sitting in here, sitting in my office right now, and we just want to walk her through what happened. There's certainly opportunities on both sides. And then, of course, if there's something that you'd like to send to me, feel free to send it to me. Certainly things that are escalated, right? If you get a question Sunday, I know you're certainly not afraid to, Judy, as well. If you get an answer that you say, I don't know that I like the sounds of that, or I think we could be doing better here, give me a call, send me an email. I'll investigate. We'll see what's going on. We want to make sure that we're delivering the best service that's available, but I think it's also not only respectful, but it's our due diligence to provide the fastest responses as well. Again, based on the sense of urgency attached to all things that are pharmacy, whether we like them or not. So, Elon, I'll have you jump forward to the next slide. The online resources, and actually, Elon, I have the website up and running. If after this little slideshow you want me to give a quick tour of the website, like a 2 or 3 minute rundown. Yeah, so the mobile app again, this is one that people say, oh, I can't find the mobile app. It's important to remember you need to type in the ProAct and then space RX. That'll get you there both on the Google Play Store and for Android and the Apple, the iPhone store as well. It's completely free. It's got a lot of the same functionality as our website, which we'll see here in a minute. That'll get you, I would say, 99% of what you want to do if you're looking for a quick reference. The really great thing, and I know Beth and her team talked about it, is that ID card. Getting access to your ID card is probably the most important thing for younger people on the plan that don't use it on a regular basis, but have decided this year that they're getting their flu shot. They don't want to go to the doctor, so they're just going to go to the pharmacy. This is the time of year where we get all these people that either have since lost their ID card, or the pharmacy has entered their ID card incorrectly. Again, some of those things could be resolved just by having access to the mobile app or the website.
Corey, I'd add that came up a lot when people are trying to register for the flu clinics. I don't have a ProAct card. Like, yes, you do.
Yeah, because, and really, I think it's because they get the Excelis and the ProAct card. So they're like, oh, I only need one of these. And, I don't take any prescriptions, but I know that someday I might have to go to the emergency room or urgent care, so I'll keep the Excelis one. Maybe the flu is just nicer. I'm not sure. Maybe people.
I would just like to make a plug. Your group is really easy to email. Say, hey, I need a new card for so-and-so. Send me a copy and I'll send it on to them. I'm usually getting them in like 15 minutes. So thank you for that.
Yeah. So that's another good point is, we are kind of a big cohesive team at ProAct. All of the people through our operations team work directly next to each other. And it's almost like a staircase escalation system, right? So if a call comes into our help desk, that will be very quickly escalated based on what's needed to our eligibility team, like Judy said, to get an ID card in and emailed back out to somebody. That could go through our client support team, which is the team that works directly underneath me, who I partner with on a daily basis to make sure that the concerns that are coming to them are handled and handled properly. So thank you for the plug, Judy. Absolutely. Email is becoming a great opportunity, I think, for people to do things that we traditionally have always done by phone. So the next, Elon, if I could have you go back one. The one thing I did want to discuss, and I think everyone's got a good concept of it, but the one thing that we have been pointing out to people more so lately than ever, I think, is the mail order pharmacy. One, we've just had an increased volume of calls come into our help desk regarding the mail order pharmacy because people don't want to go to the pharmacy. They don't want to have another reason to leave their house every month in today's world. The 90-day supplies at the mail order pharmacy, there's savings associated with it. Again, you can sign up a plethora of ways. You can give us a call. I think the phone call, to be quite honest, is the easiest way to do it. If a member calls us, we'll walk them through the process. We'll manually enter them into our system to get them signed up for the meal order. And if the member knows their doctor's fax number right offhand, we'll reach out to the doctor for that member to get a prescription for them. So it's really hands off outside of a 5-minute phone call. And then that member, again, gets a 90-day supply. They're not chugging to the pharmacy every month to get their prescriptions, and they're paying less. So one thing to remember, and I think it's going to become more and more important as we see this kind of this COVID thing continue to evolve, right? I don't think it's going to slow down here in the next couple of months. And we're really going to find out, as far as on the drug side, what type of shortages are happening. And I personally think that it's the best time ever to have your maintenance drugs delivered to you at a 90-day supply. Oh, we're getting something in from Denise. If you want to read that, Elon.
Okay. It has been a while since I have logged into my account and it will not let me now. How do I get my login and password information?
Yeah, good question. So let me log out. At the very bottom, there should be 3 options. There's a forgot your username, forgot your password. And then if you have never, you can create an account from there. So kind of like standard website, that'll be sent to your email. The tricky part's going to be is if you have a few email addresses and you don't know which one it went to. At that point, shoot me an email and we might be able to look that up on the back end and just kind of look through where you may have signed up and what information you might have used. But let's start with the forgot your username or forgot your password. Looks like we're getting another one.
Michelle, if you wrote more than just Corey, we didn't get it.
Yes, I was just wondering if you could briefly talk about the steps required for some of the drugs, starting at a base level and having to move up through to get to the drug that the doctor actually would like you to take. Can you just briefly talk about how that works?
Oh, so I'm thinking you mean step therapy.
Step therapy, yes, thank you.
Yep, no, perfectly okay, Michelle. So step therapy is a process that it covers about 60 drugs today that are largely what are considered a non-preferred brand name drug on our formulary. So it's not every brand name drug. Certainly not every drug in specific classes, but there are drugs that we recognize that have lesser expensive competitor products that are labeled by the FDA to do the same thing in arguably the same way. So they're not 100% exchangeable, but they are comparable in the way that they treat a condition. So now let's give an example, right? So Corey goes to the doctor, and the doctor wants to give him drug A. Now, Corey gets his prescription sent to the pharmacy like he does every time. The pharmacy is going to try to fill that prescription like we kind of talked about at the beginning. That prescription is going to reject. It's going to say, Corey needs to try drug, 1 before they get drug A. Now, that being said, sometimes, and specifically with the consortium, we deal with it where we might not have the whole history, right? Corey might have tried drug 1 10 years ago and it just didn't work for him. And that's how we got to this new drug. We urge someone that when given the alternatives, right? Because that's what's going to happen is there's a drug that they need to try, drug A, before they get drug B, right? If you cannot take drug A, you know that, or you have taken it, please consult with your doctor, have them submit information to us that says that you've already tried it, and at that point we would allow it. So it's really not meant to be a barrier. It's really meant to kind of be a way to push people to the lesser marketed generic products, if we're being honest, right? So, and not to get into the weeds on the pharmacy side of things, but the one thing that we continue to see is brand name drugs that are marketing directly to physicians. Physicians don't deny that a generic drug will do the same thing as the brand, but the top of their mind is that brand name drug for that member because they may have just gotten a coffee mug from that manufacturer. So that's what we see for the most part is, you know, hey, have you tried this? The same thing. If not, we'd like to see you try that before you get the brand. So really long-winded example there, Michelle, but did you have any questions around that?
No, that's fine. Thank you.
Sure. And just really quickly here, you know, again, you can enroll through calling our customer service help desk anytime, 24/7. Once you're enrolled, you're able to check, you know, the order status, the refills, what's available to you. We always recommend allowing 7 to 10 business days to refill your medication through the mail order service. That being said, you can refill a mail order prescription up to 21 days early. So you can refill them pretty early. A rule of thumb is on things that are not controlled substances that state laws say, hey, you can't have it super early. You get a week of an early refill, and this might just be good information for you guys, a week of an early refill for every month of drug you get. So if I go to Kinney's and I get 1 month of my blood pressure drug and I'm leaving for vacation, I'm heading to Florida, but I've still got 6 pills left, you can go and pick that up again, right? As long as it's within 7 days of that window until you run out. And that should put you ahead of time. You know, this time of year when, you know, snowbirds are flying back and forth from, you know, specifically New York to Florida, we run into that all the time. It's, hey, I don't know if I'm going to have enough to get me through the trip. Just refill it a couple of days early. It's certainly okay. And although there's a note on it, if you're receiving a controlled substance, a signature is required. I never recommend that you get a controlled substance through the mail order pharmacy. As stated, it takes 7 to 10 business days on the long end. There are a number of times that you get it within 2 or 3 days, but it can take up to 7 to 10 business days. State law says that we can refill a controlled substance up to 3 days early. 3 days is a lot less than the 7 to 10 business days it could take. So even if everything works out, we get the prescription, we refill it the same day, we send it out the same day. If it sits in the mail bag, you know, at the post office for 3 days, you have an issue, you're running out. So get those prescriptions from the retail pharmacy. Not to mention the greater majority of them you can only get at 30-day supplies anyway. So you really don't get a cost benefit anyway. And here again, you know, feel free to enroll by way of the mobile or the help desk, and checking your order status and refills are available online as well as over the phone. And last but not least, before I touch base on the website, is CanRx, the annual CanRx reminder. CanRx is an international mail order pharmacy. So they work just with brand name drugs and just a small list of brand name drugs, actually. They work to find access to these brand name drugs, which are available on their website, CanRx Savings Program. There's also a link to that on the Health Consortium.net website.
And there's a direct link to the formulary.
Yep, direct link to the formulary as well, which does get updated from time to time. Again, you get this one for a 90-day supply. Now, the trick to this one is because these drugs are filled internationally, and if you've listened to the news of the recent debates, there's one thing we know is that brand name drugs in other countries are less expensive than they are in America. That's kind of the reason we take hold of this CanRx concept so well is they're the same drugs, right? The manufacturers are the same. They're sourced from the same places as the ones that we get in America. Now, when it's a Canadian pharmacy or pharmacy in Ireland or the UK or New Zealand or Australia, those costs are about 50% less. Now, the plan has decided, hey, because those drugs are so much less expensive, let's incentivize members to use that. So members that fill at CanRx go from paying, up to $70 for a brand name script to $0. Plus they get it for 90 days. It's really a great benefit that's, I think, and Elin, correct me if I'm wrong, I think it's very underutilized. There's still a ton of people left on the plan that could be using it. So the one thing, we always tell people is always ask your doctor if, there's a generic available, and periodically check that CanRx formulary or look out in the mail. CanRx does on a pretty regular basis mail out to members that could potentially be using the program. Just keep that in top of mind, because it's really a great program that saves a ton of money for everyone, right? So again, my annual plug, you don't have to hear from me again until next October when we talk about the CanRx thing. And Elin,
Okay.
we to take control and do the website, or do you want to move on?
Go ahead.
Okay.
You have 10 minutes.
I should be able to do it even quicker than that, I think. So let me just share my screen. Okay. Is everyone looking at my screen?
I am.
Perfect. So this is a test member, the Open Doors benefit there. This is what you're going to look at when you sign in. So there is a step right before this. Of course, the sign-in page where you ask for your username or password. Here we see, this is kind of the general benefits page. So it shows you, hey, this is who your employer is. This is your formulary. Now, the formulary, if you click on this, I won't because it'll open a separate tab that I don't think I'll share anyway. That'll pop up and show you that the drugs that need step therapy, that need prior auth. It'll also show you what's a generic, what's a tier 2 brand, a tier 3 brand. Is this drug a specialty drug? It'll show you all of that right there on the formulary, as well as through the formulary lookup tool. Now, I will say this, when comparing drug pricing, formulary lookup, all day long, I recommend drug pricing. The drug pricing does the math for you. It tells you, you type in your drug, and again, it does pull a pop-up, so I won't necessarily click on it. But you actually enter the name of your drug, the strength, how many times a day you take it. You can enter your doctor's information. It will look up different pharmacies in the area for you and tell you how much that drug would cost at different pharmacies. That's extremely important for those of you guys who have members on the bronze plan, because it would just amaze you if you knew that you could get a drug for $30 here that costs $4 at the pharmacy, maybe a mile away. Drug pricing can vary that much. It's an important tool. It is a live claim, which means that if you enter this today, it will tell you, oh, Corey, that's great. We want that. We want you to have that drug as well, but it needs step therapy. So anything, any barriers or roadblocks that you might have, you'll find out right here on the website. And again, this is available on the mobile app. So you can do this right in your doctor's office. Your doctor says, hey, I want to put you on the drug Bistolic. I really think that's the right one. You can pull up your app. You can say, oh, okay, it looks like I'll pay $40 for that. And then you can ask the questions, okay, well, is this a CanRx drug, or is there a generic that I could take instead of Bistolic? You can ask those questions to kind of be an active consumer. But moving on from there, claims history. So as we talked about, and there might not, I don't think there is actually any, because this is a test person. Yeah, there's not going to be any claims for this person. But this is where it would show you. It would show exact where you had it, when you had it filled, the pharmacy, what the drug is, how much of it you got with the plan paid and what you paid. You can also vary this from year to year. So if you're doing year-end tax stuff, you need to know how much you paid last year. You can do that as well.
Another time when this comes in helpful is if there's a discrepancy between your HRA. So if you look at Excelis and you say, you know, my deductible, I've only met 80% of my deductible, and you look here and you're trying to figure out your how much you've spent in prescription drugs, you can see the prescriptions you have filled, and maybe one of them you paid, you know, it was for $5 or something, you paid for it out of your pocket. So it keeps track of here, and you can check it off your HRA and what your HRA, you've used your HRA for.
Yep, good point. Good point, Elin. That's kind of, you know, like Elin said, you could kind of use a little bit of math, check the Excelis website and the ProAct website, add those up because they do more often than not accumulate together. So that's another good point. But from there, the mail order pharmacy, we click on this tab. Here is where, if you're set up with mail order already or would like to, this is where you would go. Now you can, I do have to say this, your My Prescriptions, refills, orders, tracking, none of that will show up until we actually have a prescription, right? So if you're using Kinney Drug, CVS, Walgreens, and you're interested in mail order, you cannot just come here and say My Prescriptions, click it, and expect to fill your blood pressure medicine. We need to receive a prescription in-house. Once we receive that, you'll be able to click on these tabs, navigate through them, go to My Prescriptions. It'll tell you, hey, here's what we have, we as mail order have on file for you. You can click through there. You can, you know, manage your automatic refill. Do you want to get it every 90 days and not have to think about, oh, I should call 7 to 10 days beforehand? Clicking, enrolling in the automatic refill will automatically send prescriptions out. In fact, when you run out of refills on your prescription, the automatic refill program will automatically reach out to your doctor, get a new prescription, and then send that prescription out as well. So it's really designed to be hands-off. The payment methods, you can add, remove, or change your credit card as well. And lastly, the My Resources today and this is the same for what it has for the consortium. This is largely just diabetes information. There's a ton of good information actually. Between Deborah and Elin, we've had the consortium publish some of this information as well. But some good reads here for anyone that's diabetic interested or anyone that's interested in diabetes. So that is the website. That is my portion of the slideshow. Does anyone else have any questions?
I guess not. Can you stop sharing? Okay, perfect.
Yeah, I didn't want to quit before anyone, or if anyone had any questions.
Great, thank you, Corey. I think we messed up a little bit on our presentations because I believe Libby's presentation was not a PowerPoint. Is it a I can't, was it in another?
It's a PDF.
Thank you.
It's a PDF version of the PowerPoint. Would you like me to share it?
Sure, go ahead if you have it, because it didn't get into the PowerPoint, so we jumped right over you, Libby. So please go ahead.
That's no problem. I'm flexible. Thank you, first of all, for having me again. Give me 1 minute, and let me just pull that up. All right. Can everyone see my screen? I can.
I can.
Excellent. All right, this is for you all. What I'd like to suggest is I have some tips I'd like to share with you. I know most of you are experienced users, but we might have a mix. Please ask questions at any point, and I'll be more than happy to address them. You do not need to wait to the end. And if we have time and you'd like me to, I can also do some demonstrations. Now, while sitting here listening, which by the way was incredibly valuable for me, because I learned how to help you all as well, please allow me to try to put some things together that will help you share with your own employees. As it was mentioned earlier, I believe Elin mentioned that we have, and so did Beth, a pretty terrific website. There's so much out there, and we're constantly adding and building and refining for members as well as other constituents. We also have a pretty terrific mobile app, as Elin mentioned. It's absolutely fantastic for your dependents and your college kids who are away. And there's so much at your fingertips. And I have to be honest with you, for me as a personal person, I hardly ever use desktop anymore. I use my mobile app. I'll put some things together that might help share. I would also be more than happy to have some kind of sessions if you think that would be helpful with your employees as a volunteer type of basis. All right. Also, a couple things I heard on the call. I think there's, correct me if I'm wrong, but I think there's some interest in adding dependents. What kind of paperwork is required through web enrollment? Correct me if I'm wrong. I have to tell you, I'd be happy to show you removing dependents. I would be more than happy to show you. Just a couple things. If you do something or miss a mandatory field, it will tell you. For example, if a wife is already on a policy and you're adding a new wife, it will edit out that, you know, you can't have two wives on a policy. So the prior wife would have to be removed first. All right, let me get started. And I'm going to go through these fairly quick. Here are all the different topics that I included in this subset. The full material has also been sent out, or hopefully sent out, which is a lot larger. But what I want to emphasize is this is a really great resource for you, and the full package is a terrific resource. Every time I teach, I learn, I will go in and I will add a tip, anything that maybe isn't quite as clear as it should be, I will add a tip, and I'll also bring it back for some user design changes. All right, I'm going to go through quickly unless you tell me you would like more detail. Right off the top, if you forget your password, go and use our forgot password feature. As long as you put a good password hint in there, you should be able to figure out what your password is. If you cannot, unfortunately, you would have to call our web help desk to get it reset. Here's all you need to know to reset your, or excuse me, to get your password tip. So it's just your username, first name, last name, and you just follow the steps. It will get to the point where it will give you your security question, you answer it, and then it will give you your password hint. All right, keep going. This is probably the #1 question that my team gets daily. When you're added some group numbers, some structure changes, the first thing you want to do before you start your open enrollment process is to go in and activate or remove any old group numbers. It's a very simple process. You simply follow the instructions and submit it in, and it takes about 2 to 5 business days to get group numbers added, or if you have some very old ones and no retroactivity, feel free to have them removed. I'm pretty sure you folks are familiar with Roster. If not, let me know. But this is a great tool. And I heard earlier, I can't remember her name, I apologize, but she mentioned how terrific this tool is for balancing back your invoices. And also, this is what's going to help you know when changes are complete. This tool in relation to the recent submission tool are probably top tools that you will use on a daily basis. And I'll show you that one. It's fairly new. Again, if you want me to go deeper, let me know. There's so much you can do with Roster. Again, I'm going to just touch on it. Right on up here, you can decide what group numbers you want to see. You don't have to see them all. You can see a subset. You can also see a subset of just terminated if you'd like, or active, whichever you prefer. You can download the results, which again can easily be copied into or migrated into a different system. Or if you wanted to just do some analysis, the data gets downloaded in a Excel file format or CBS, and you can do whatever you need to do with that data. You can also do searches. For me, for example, I would always start with roster, but it really depends on what your goal is. If you need to make a change on one policy, this is not, necessarily where you would go. I can show you a faster way. But if you are in roster, you can easily go down and do a search, or you can select from the list and get to the member you need to make a change or whatever you need to do. Just about all the different transactions, update transactions, add, remove a dependent, can be accessed right off of the member's eligibility off of roster. So that's another reason why it's convenient, but you don't necessarily have to go this route if you're just working on one person. This is where you would find address change, request an ID card if the member doesn't have it yet, lost it, or again, they can use the mobile app or desktop and request it themselves. You can also provide to them a temporary ID card. As the gentleman said earlier, pharmacy, you might have an emergency and they might not have all their paperwork yet. You can also easily produce a temporary ID card, which can be emailed to them directly or, hand it to them if they're in the office. Adding, removing dependents are down here. It's pretty simple, but I want to show you a couple places that sometimes people get a little hung up. Please stop me if I'm going too fast or if you have questions. To add a family member, you're just going to go right down here. Well, select the policy, go down there. And this is one thing I want to really point out to people. There was a lot of really good discussion on this. We do explain some of the more common reasons for adding and what would be that date. Is it the date of adoption? Is it the date of divorce? And yes, yes, and yes. Also, I want to point out that in this step, you want to make sure that you're just using the right qualifying event and the effective date, which usually in these cases are one and the same. Date of marriage, date of birth, whatever the case may be. This is where you would add a family member. Again, if you were doing a new ad or adding a dependent. This is really important. You want to make sure you do select the coverage, or in some cases, the dependents, you might get confused and they might not get the coverage that you thought that you submitted for. And let me show you how you can figure that out. This also allows you several places, in fact, 2 places where you can double check your information. If you realize there's some kind of edit or typo, you can either edit it or you can delete it. And then you can go on and do the next family member. The most important thing, obviously, is making sure everything is entered as accurately as your source is. And make sure you select the coverage. From here, you could go on and add more or move on to the next step. All right. This is, again, more Medicare information, which unless you want me to, I'm not going to go into too much detail. Again, basically, you're filling out the information, and that would be transmitted on the enrollment. All right. Other coverage information, you would fill it out here and include the information, their other member ID, the company, and so on and so forth. There is a place to search for that other carrier, and most of the common other carriers are all right in there.
Hi, Libby. I do have a quick question with regard to COB because this question came in to me as well. And that was that the dependent had secondary coverage, which was Medicaid. So it would be, I believe she said New York State Medicaid, and there was not an option for that.
Yeah, I would say that's probably a bit rare. I would probably do other. I'm
Other.
not up on coordination of benefits. Eric, this might be a question for you because my thought would have been Medicaid would have been primary, but I'm not an expert. But yes, go ahead with other.
Okay, thank you.
And that will allow you to move forward. Now, again, membership might have to go out and request info in that case. But other than that, I'd go with other.
Eric,
Great question. Thank you.
would you happen to know the answer to that question? Would membership reach out directly for additional information?
I will take a look. I'll check our processes. I believe with Medicaid, that government insurance is generally the payer of last resort. They generally want
Okay.
folks off of Medicaid and on the commercial coverage if it is available to them. But I'll check. I'm going to add it to the chat list of questions that I have to get responses to.
Thank you very much.
Would you let us know too, Eric? His department and our department work very closely together.
Definitely.
That makes a lot more sense than what I said. I would hope that's kind of rare though, but who knows? Thank you.
Thank you.
All right, let's keep going. Again, I'm going to pass through these steps because I believe you folks are very experienced. When adding a dependent, now this is straight adding a dependent, the coverage is already in existence. Again, I can't emphasize enough to make sure that you select the coverage. And again, dental, medical, select whatever coverages are offered to that employee to make sure that they do indeed get the coverage, because not necessarily would they elect to get both medical and dental. It's very possible, for example, the spouse has coverage for maybe one of the two. You will get a confirmation. You do need to allow, I would say, 2 to 5 business days when it's not in the, open enrollment. It might take a little bit longer during open enrollment, 3 to 5 days. To be very transparent with you, very little from the web should be pending for manual intervention. There are a few things that would pend for manual intervention, and then Eric's team would pick up, make sure it processes through as it should. But in most cases, it should go through very cleanly and process. We do, as you hopefully know, we make changes and updates and enhancements all the time, and we continue to reduce what would fall out for manual intervention. Let me back up for just a second. A lot of folks like to save screenshots for these, and you can if you would like, but honestly, all of this is stored in recent submissions. That could save you a step. Also, you could, and I'll show you that in a minute, you could use recent submissions to provide any type of confirmation to that employee if you need to do that. And recent submissions will capture everything that was submitted, either on a new enrollee, a change coverage, an add a dependent, a remove a dependent, or a cancel policy. And it will keep those records for 3 months. All right. Change coverage, you can execute one change coverage transaction to change both medical and dental, or one of the two. You do not need 2 separate transactions. The only time you would, which hopefully would be rare, is if there is a different effective date on a new ad, a different start date maybe for dental from medical, then yes, that would take 2 transactions.
Libby?
All right. Yes, ma'am.
It looks like Denise had a question. Denise, would you like to ask your question with regard to domestic partner?
Well, I was just saying it should be in there throughout. There's a place in there, I know when I've tried to, when they want to know the relationship, it doesn't have domestic partner, it says spouse. And so sometime when I went in on the, on the website to see their information, it says spouse, and I wanted to say domestic partner.
I'll double check, but I believe domestic partner should be there. If you would like, I could go take a quick look now.
Yeah, I think it's under when they ask for other, when they were talking about other insurance. If you can't find it, the next time I go through there and do it, and find it, I'll print it out for her and give it to Terry.
So for sake of time,
Yes.
can we look it up
Okay, yeah,
afterwards?
for the sake of time. Absolutely, absolutely. Let me just take that down real quick. Can you just tell me one thing? What particular feature are you saying that you're not seeing domestic partner? Do you know if it's like a new ad, a change coverage?
Well, it's when I'm adding, it's when I was adding a domestic partner to one of our retirees.
Okay.
I think when it was under other benefits, when you typing in, because she has other insurance, so when it asks a relationship to the retiree, it didn't say domestic partner.
I see.
I think that's where it's at, but we can do that later. Because in the interest of time.
Thank you. I think I know what you're talking about. Thank you. Yes, I'll take a look at that. All right, let me go back to the presentation then. All righty. So change coverage obviously is probably the most common transaction you're going to want to do once you've picked up that employee. It's all pre-populated. It's the easiest one to use. Same thing with remove a dependent or cancel a policy. Those are pretty easy to use. A new ad obviously would have probably the most entry because we don't have that data. As long as we have that member in-house, we're going to pre-populate the information. So it would be the least amount of entry for you. All right. One thing I want to just call out on change coverage that sometimes we get a lot of questions for. Again, it will present, would you like to change your coverage for medical? Would you like to change your coverage for dental? If it's offered, obviously in this case, it will not be RX, but if you also had RX, you could do it all in one transaction. If the member does not want to change their medical coverage, then you're not going to check this box and they will not lose the coverage. This just means, yes, I want to change the coverage. So this is what you would use, for example, during open enrollment for a coverage change. It's also possible for them to change only their medical, leave their dental, or the other way around. Let me keep going because I don't want to run out of time. Again, this is where you make sure that you've selected coverage for the dependents, and this is a great step to edit if you have a typo. There's two really great places that you can proof and fix any typos. I'm going to go through this pretty quick. The change coverage summary, after each transaction, let's say a new ad or a change coverage, which I'm looking at right now, or a dependent ad, etc. You're going to get a step right before you submit final submission button. That step is going to show you, display to you every single field entered and the data in there. It will also allow you to edit anything. This is your great point to stop and proof everything. And I would say, please scroll all the way down, because this is where, unfortunately, we've had some folks miss that dependents weren't picked up because these boxes were not checked. Scroll all the way down, proof it all, edit if you need to. It's the easiest place to do it, and then hit your submission button. Again, I'm just warning, scroll all the way down. As long as you see this green check mark, you know all the dependents were picked up with the appropriate coverage. I'm going to scroll down. You will get a confirmation. Up to you if you want to make a print it, screenshot, whichever you'd like to do. You don't really have to anymore unless you have a business reason to, because it's all going to be in recent submissions. All right. Let's see where we are. Reason for cancellation. The only reason I have this here is I just want to make sure that folks know it is important to select the closest reason to the actual reason, because there are certain processes that could be generated from the reason why you select. For example, we added due to the pandemic. Things like COBRA would not necessarily kick off. Reinstate. As I believe one of you already pointed out, web enrollment will allow you to go back and do a reinstate back to the first of the previous days. use web enrollment to initiate that reinstate. That would be the fastest way for you to get that updated. Now, your group, and there are circumstances where maybe you need to go back beyond the 30 days. In that case, you could submit it directly, and I'll show you how, using the Contact Us email process. However, Terry, you mentioned you like to see these first. Is there a specific process that you would like followed if it's beyond the previous 31 days?
Ultimately, in that case, the individual would have to send that to me directly, because then,
Okay.
well, either they don't have the capability to do that online, or I would have to, if it was beyond 120, I would have to initiate a retroactive exception.
Okay. Thank you for that clarification.
But the additional option is the enrollment. My apologies. The enrollment and billing support form. Was that, did we go over that?
That's what I'm saying, and I'll go over that in a couple minutes.
I'm sorry.
Actually, I can go to that now.
Thank you.
Yeah, let me just go to it right now. I know that upon occasion, for example, I don't know, maybe a date of birth was somehow entered incorrectly, or a social security number was. Name change. When you only have to do a name change, a date of birth change, a social security change, or a retroactive reinstate beyond the previous 31 days, the fastest way to get it to our enrollment department through web enrollment would be to submit it through this link right here. It would take the middle person out, and it would get that update to that enrollment department, the work department, quickly. So that would be the most efficient way, unless you have a particular process that Terry or Beth wants you to follow, or Elin wants you to follow. Again, I would allow 2 to 5 business days. It is possible it could be a little bit longer during open enrollment, but I have to say the team does an excellent job staying on top of the in and outgoing work. This is a really important feature, and you can get to it right off your homepage. You should log in. I want to emphasize again, log in. You'll see a lot more features if you log in, and it's just much easier. You'll get to everything you need to get to. If for some reason you aren't seeing the features you expect to see, I'm going to guess you're not logged in. In order to use this particular link, you must be logged in. Now, a couple other places. I would suggest that you make sure you have backup coverage. I'm sure you do, but for example, on my team, I like to have what I call 3 people deep, meaning I have at least 3 people cross-trained in case something happens. Don't wait. Make sure your folks have their security, because it does take 2 to 5 business days to get security, and you cannot share. So make sure you have that all ready to go. You can get to the security registration forms from here or right off the homepage, the employer homepage. To add or remove group numbers, again, maybe this open enrollment, you're adding new group numbers, get right on top of that, and you can go right here, submit that request, and again, allow 2 to 5 business days. Then you should be in good shape to start tackling open enrollment. If anybody needs website training, please use this link, and one of my teammates or myself will get back to you, and we will schedule it directly with you. And what we do try to do is meet your needs. I don't want to go into a lot of stuff if that's not really what you're looking for. So I have you guide me. Questions on this? Okay. Couple things. Is there something specific though, because we're running out of time, and I really want this to be for you. I'd love to show you recent submissions, but if I have not covered something that you all need, please tell me.
Libby, this is Beth, and we are kind of crunched at time right now because Jason does have some important information to share. So as Elin indicated, this will be recorded and it is materials actually live that will be available for them to reference.
Yeah, and I'd like to say, because we are running out of time, and since we've had people on the phone since 9:30, I don't want to run over today. And I do want to wrap up some stuff at the end. What I'd like to suggest is that Jason has a lot of good information. I would like to table Jason's information to the next joint committee meeting, which is the first week of November, and have Jason do his full, rather than rush through Jason's presentation. It's the first Thursday of November at 1:30. And I'd like to invite all of you, most of you come to that meeting already. I'd like to invite all of you to come to that meeting. Jason, if you're available, would you be available to do that rather than to rush through your presentation now? Yes.
Yeah, so I do. Yep, I have it on for the 5th.
And I will send an invite to all of you to attend that. So we will do that. I do want to wrap up a few things in the last 5 minutes. So I'll let Libby close out for 2 minutes, and then I'm going to wrap up for 5 minutes, and we'll talk about next steps. So Libby, if you just want to point people in the right direction.
I will do that. Thank you so much. I just want to talk a bit about recent submissions. I will go really quick, but this is the transaction I mentioned that will store the previous, for 3 months, the enrollment transactions that were submitted. You'll see a list. It will give you the subscriber's name, ID, what type of transaction was submitted. And if you select that particular subscriber, it's going to show you everything that was entered and transmitted on that enrollment. This is the tool I was saying that if you did not want to keep copies anymore, you would not have to unless there's a reason to. You can go right here, and this could also be if you needed to transmit something electronically to your subscriber, your employee, you could certainly use this unless you have other means. At this point, unless you have specifics for me, I want to thank you, and I will allow you to wrap it up. It's been my pleasure, and I will stop sharing.
Libby, thank you. As always, you do a wonderful job with that. And it is very important to have the tools and resources. As mentioned, you have the billing, enrollment, and billing support that members definitely want to touch first before, if they're not getting their answers through them or through the support channel, then they should be coming to Terry and I. But this channel is the most utilized, but also the quickest response time for members to get information right back or any updates. And it's accessed and reviewed on a timely basis. And it actually is the quickest way to get a correction done.
Right.
So thank you.
All right, good. Thank you very much, Excelis and Proact. Couple things I just want to remind everybody of. This is November is the consortium open enrollment period. For any changes, anybody able to make any eligible employee to make any eligible change, that you would allow them to do that in the month of November. This group particularly, you do the data entry for any of those changes. Excelis goes dark in December. If you want your employee to be enrolled in the change, you are going to have to make that data entry change by the end of November. So I'll advise you of two things. One, don't wait to the end to start inputting. As people make their change, please start inputting right away. And also don't think there's some catch-up period later in the year. You really need, we've had that happen in the past where we thought the window with the Excelis would open back up. It didn't, we didn't get everybody's information input. So please start putting information in as soon as you receive it for the January 1 effective date. So this is your open enrollment for anybody who is an eligible employee that is eligible to make a change. It does not have to be a qualifying event during this time period. So that's one reminder I want to have for you. We talked about COBRA earlier, but there is information regarding COBRA. We've got a little toolkit put together from the consortium. We've already referenced the Excelis Administrator Guide that you can have in hard copy as well as reference on our website. New York State has some interesting COBRA laws allowing you to offer COBRA for 36 months. And I know some of you are still operating under the 18-month rule. So please, please call the State Department or call your COBRA expert and find out if you are able to extend COBRA. And also during the pandemic, there's been some other COBRA rules that have been relaxed. And I would just want to bring that to your attention. We've had a lot of questions regarding COBRA recently, and I want to make sure you're up to date on that and you get the proper legal advice you need on what you're able to offer. We will be doing a beneficiary audit probably in 2021. So we were talking about documentation earlier. You as the employer can keep as much documentation as you need, provided you follow the documentation and HIPAA laws and all of that. And we, from time to time, as the consortium, feel it's important to do a beneficiary audit to make sure that all of the people on your plan are should be covered. So a lot of times there are spouses that are no longer spouses, domestic partners that are no longer domestic partners, occasionally someone that ages out, although we're catching a lot of those now through Excelis dropping them off. There are sometimes payment is made automatically for a deceased member. So there's a lot of auditing that needs to take place, and it's expensive for the plan to keep people on it that aren't covered. So we're going to encourage you in 2021, after we get through open enrollment, to do a beneficiary audit. So more information will be coming on that, but make sure you keep those files, especially during open enrollment as people make changes. Okay. Wellness, we are going to move our whole wellness chapter to the joint committee. As we just said, we're going to have Jason do demos regarding the website. Corey showed us ProAct. We're going to have Jason show us the website. I've been getting a lot of questions about that recently. Employees trying to access the website and where they can find information and how to find information. So Jason will be doing that at the joint committee as well. So we'll table that information for then. So this is all of Jason's presentation that we will find out about. So first, I want to thank everybody that participated today. I've been receiving some positive feedback through the chat box that I think most of you can see. It's always a joy for someone to attend a meeting and say they learned something new. So mission accomplished today. Thank you, Libby, for making that happen. And just a reminder, this group is the group that specifically goes to Excelis and goes to ProAct on their own, because you've been doing that for the last 10 years and your relationships are solid and you all work together really well. Terry and Beth explained new routes that you can take to access information, whether it be through your website, through the customer care. ProAct talked about how to get information, but please don't leave the consortium out of the loop. Our customer service is only as good as the information we receive. Some of you know we had a major debacle this year regarding accumulators. The reason I was able to figure out there was a major problem is I received 3 phone calls in a row. Those individuals had contacted ProAct, they had contacted Excelis, they had contacted ProAct, they had contacted Excelis. Excelis was dealing with their problem, ProAct was dealing with their problem. It was the consortium that brought it together and made it bubble to the surface that this was a group problem and not an Excelis or a ProAct problem. It was a consortium problem. So please don't, because we do have different administrators, please don't leave us out of the loop so we can help resolve some of those questions at a under the consortium umbrella. The other thing that I wanted to just make sure before we got off the line, and I just realized I do not have my video on. Sorry, I can't read my small screen, which has my camera on it. So I always have to go to my large screen when we're presenting. A lot of good information came up today. I'm sure you will have questions afterwards. We never answered, can I add my mother who's coming to live with me? But there will be other questions like that going forward. So I want to encourage you, please shoot your emails through Deborah Meeker. We will share them with the whole group. We also have 2 more of these presentations to all our new members coming on board. We have 7 new members coming on board next year, and also to those who don't do data entry directly with Excelis, they do their data entry through Jessica Hobart. So don't hesitate to contact us if you're looking to find out if your mother or your pet or your domestic partner are covered under the consortium plan, or any other questions relevant to today's presentation. I'm sorry we ran out of time, but I think it's great that you were able to ask your questions as we move forward. So before we close, is there anything that we need to cover? If not, thank you, Corey and the ProAct team for participating today. Excelis, thank you to you and your team for participating. Nice to see all your faces. Jason, apologies for making you sit through this and then not having enough time to have you go through, but we do look forward to welcoming you at the joint committee. We will send out the invitation to that. And thank you to Deborah for organizing this and making it happen for us logistically today. So best wishes to everyone during open enrollment, and don't hesitate to call us if you need any assistance or any help along the way. Thanks very much and look forward to seeing you all soon.
Okay.
Thank you.
Thank you, everyone.
Thanks, Elon.
Thank you.
Great job. Thank you.